In this chapter, we'll discuss planning learning. So the objectives for this chapter, we want to be able to differentiate between teaching and learning, describe the necessary steps to planning effective educational sessions, discuss the process of developing performance objectives, write performance objectives using Major's 3 components, compare the 3 domains of learning, and how to write objectives for each of those domains. So if you're not sure where you're going, you're liable to end up someplace else. And so this is from Robert Major. So again, looking at teaching being a major job responsibility. So again, no matter which domain dietitians work in, whether it be community, food service, or clinical, teaching is always a major job responsibility. So that can be training or teaching employees. That can be teaching the general public. So for example, if you're working in WIC and you're having to work with moms, or this can be if you're trying to work in the clinical setting, whether you're having to teach other staff members such as nursing, or if you're trying to teach patients. And the Joint Commission does require education of the patient and their family for certain disease processes, medication interactions, etc. And again, the goal of teaching is to promote learning. So again, we talked about those different locations dependent on which domain a dietitian is working in, but this can be inpatient or outpatient. This can be working with renal patients, cardiac patients, acute or long-term care, assisted living or home care, public health or government programs as we discussed with WIC, health fairs and community events, work sites, and media outreach. Again, depending on the location and the different domain the dietitian is working within, you're going to have different audiences, but this can be patients and clients, employees, parents and caregivers, family members, and then other members of the medical team such as nurses and physicians. This can also include, though, teaching, for example, students, interns, or residents. And so I have actually had to teach the medical residents before, so they actually had us rotate through. And again, so this is what I found is that the new generation of medical students is very open to learning more about nutrition. This can also include, though, teaching teachers or therapists, paraprofessionals, athletes, and the general consumer and public. Now again, what we said is that we're actually looking at specifically teaching. And so here we have the assessment of the need for knowledge and techniques specifically to transfer knowledge. So again, teaching has a purpose, which is you're supposed to be gaining information, right? It's not just talking for the sake of talking. And so education, right, is the process of imparting or acquiring knowledge or skills. Now the biggest thing, though, for teaching to be effective is what we need to assess and determine is learning, which is the cognitive process in which people acquire and store knowledge, attitudes, or skills. So if somebody is teaching, but then the audience isn't learning, then honestly the question becomes are they actually teaching? And so that we can talk more about that. But again, so here we're actually looking at acquiring something, in this case knowledge, attitudes, or skills. Now, for an effective environment for teaching and learning, we have to take a look at the psychological environment. And so there's a great book on this, and so there's an entire cognitive psychology research book on this, which is looking at what's known as a growth mindset. So finding the ideal environment to learn. So we need a supportive, friendly, and caring environment where there is tolerance for mistakes, respect for others. We want collaboration and to encourage questions. And especially for adult learners, we want an informal atmosphere, right? So the rigidity that we expected in high school, right, where we're more focused on behavior, is a little bit different, right, with adult learners. Now the physical environment, again, we want a comfortable temperature, lighting, ventilation, comfortable chairs, ideally in a circle or around a table, depending on the number. Right, ideally, right, we would not have people block the line of sight to the board, right, with staggered seating if necessary, again, so that everyone has the ability to see and hear the material clearly. Now again, the steps to effective education is we need to assess the learning needs of the individual or the group, which is known as pre-assessment. And then we need to write measurable and feasible performance objectives that can be accomplished in the period of time, considering the domains of learning. And that's just a real fancy way of saying we need to write out what we plan to learn, given the time constraints and the domains or what we're having them learn, right? Some things can be learned faster than others. We want to determine the content based on the assessment. So again, based on what people need to know and what the end performance objectives are. And so from there, based on the content, we can select the specific methods, techniques, materials, and resources that are appropriate to meet these objectives and for that learner, right? So again, looking at andragogy versus pedagogy, right? So how do we teach adults versus how do we teach children? Now again, what we're going to then do is implement the learning or intervention and then allow practice. We're going to evaluate the progress and the outcomes in the post-assessment phase, and then document these outcomes and results. And so what this should sound like to you is the class, right? Which is you have a pre-test, you have specific objectives, you learn the material, you then take a post-test, and we document those outcomes and results and hold on to that information for long-term assessment. Now, to conduct a needs assessment, which is again something that we're supposed to do, so again, we need to assess somebody's current knowledge, skills, abilities, aptitudes, and or interests. And again, we need to take into account then, this could also be based on their personality, education level, degree of literacy, age, gender, occupation, culture, lifestyle, or specific health problem, as well as their psychological readiness to learn, right? So if somebody is there for a first-time assessment and they've never seen a dietitian before, again, their psychological readiness is very different than somebody who's in the midst of a therapy process, making behavior changes, has been working on this for several months. And again, though, people may have different starting points based on their previous knowledge, degree of literacy, based on their current knowledge, skills, etc. Now again, looking at the level of knowledge and or experience, if they're beginning level of the learning content, so again, depending on how advanced they are with the specific material, and again, clients or employees' needs need to be balanced with what they need to know or do. And so again, this is a little bit different in why you'll see. So it's a little bit different, for example, with our program, because the needs assessment, instead of having to do a test of what knowledge you need to know, we are given a list of knowledge by Ascend, the accrediting body, that says this is what they need to know. So we, as a specific university, don't determine what you need to know, though we do have some influence over that with objectives, etc. But Ascend is actually, in essence, conducting this needs assessment for an entry-level dietitian. What does a new beginning dietitian need to know? They tell us, this is what the students need, go forth and teach them. Now we can conduct this needs assessment in several ways. So we can of course just do oral interviewing, which is just ask people what they want. What do they want to learn? What do they need to learn? We can review records of performance though, so if we see a deficit in a specific area, someone's always getting M&T wrong, someone's always getting management wrong, then we know we need to focus on and teach. Again, taking into account, so if they're going to be motivated by extrinsic or intrinsic rewards. Again, adult learners are typically intrinsic. They're studying information because they're interested in it. But remember, if this is education mandated by JACO or a company and it's extrinsic, right, of course that's going to be different. You may have a pre-assessment questionnaire or test, or the pre-test that we take for each class. Training and development programs, so again, not all educations are based on what people want to pursue, but they are necessary: job safety, job performance, etc. We can also observe employees. So again, if we're trying to change a culture, we can look at specific behaviors. How does everyone currently act? We can interview managers. We can look at work reports. And so one of the things that, for example, we do in dietetics is they will actually track your specific activities. So how much time did you spend assessing patients? How many TPNs did you do per month? How many tube feeds did you do per month? How many meal rounds, etc. So again, if we're deficient in a specific area, then that's what we teach employees. Hey, nobody's doing meal rounds. Let's talk about that process, right? So we look at the work reports and things like employee attitude surveys. Again, what employees find lacking, etc. So now we're going to talk about the development of performance objectives. And so these are precise statements about what will be learned. You'll also just see these in your syllabi known as objectives. But this helps us establish the purpose of the instruction and then also as part of the tools in planning, implementing, and evaluating learning. So again, we have our purpose, we have our precise statement, we then plan our learning around that and evaluate if that statement was met. So the advantages of these performance objectives is there's less ambiguity, it allows us and helps promote our design and implement of our instruction, it can help us select instructional materials and media, and again serves as the basis for evaluating results, right? If we say this is what somebody will be able to do at the end of the session, then it's real simple to test. Can you do this at the end of the session? Now the major characteristics for our performance objectives, and that's major the person, not major with a J, is performance, which is what the learner is able to do after the instruction, the conditions, under what conditions the performance occurs, and the criterion, which is how good the performance must be. So for the performance component, again, this is the activity the learner will actually be doing. Now we have our visible performance, which can be seen or heard. So if I ask somebody to do something, or it can be invisible, where I ask the learner to do something visual or audible with the knowledge. So again, if I want to demonstrate that you have something in your brain, I can't actually look at your brain, but you can do something with the knowledge in your brain. The conditions component, so these are circumstances or conditions under which the performance will be observed, including things such as setting, equipment, and aids associated with the behavior. So for example, if somebody's reading a food label, right, they would actually have to be able to look at labels in the grocery store, right, that's where they're actually making the food choices, or in the restaurant, or for example, if you're having to do CPR, it's under a specific time frame. And then we have our criterion component, and this measures how well the individual needs to perform, so with a certain degree of speed, accuracy, quality, or most famously, probably with pre and post testing, is the percentage of correct answers. So this is the infamous, right, you'll hear in many healthcare programs, right, a 75 is passing. And so again, that would be the criterion or criteria, which is how good do they have to be at the material. Or for example, with the RD exam, a 25 is the criterion component, so how good they have to do on the test. Next, we talk about different domains of learning. So there's different domains of skills. So we have our cognitive domain, which is knowledge, our affective domain, which is attitudes and values, and our psychomotor domain, which is physical skills. Now what you'll see is in all three of these have their own system in the chapter, but they go from simple to complex skill sets. So it goes from something that's easy to something that's hard, but again, those are different individual things based on which domain it's in. So we have the cognitive domain, which is probably what you're most familiar with from school. So here we're looking at the acquisition and utilization of knowledge and the development of intellectual skills and abilities. So first, within the cognitive domain, we have Bloom's knowledge. And so this goes through the list again of increasing in complexity. So this is on page 287. So we have knowledge of specifics, knowledge of the way and means of dealing with specifics, knowledge of the universals and abstractions in a field, and being able to remember information. And so again, this is that lowest level, is just being able to recall or know the definitions, right? Next we have comprehension, which is our lowest level of understanding. And this includes things like translation, interpretation, and extrapolation. And so this is being able to actually use the information communicated. So before we were just memorizing stuff, now we can actually do something with it. The next level is application, where knowledge is understood, and you guessed it, we apply it to solve a problem. Next we have analysis. So this is, for example, analysis of individual elements, analysis of relationships, or analysis of organizational principles. So at this level, again, we're able to see the individual and combined components and the relationships between them. The next level is synthesis. So here we have production of a unique communication, production of a plan or proposed set of operations, or derivation of a set of abstract relations. So again, here synthesis means we're creating something new, which is why this is a unique communication. And so then at our final level of evaluation, we have judgments in terms of internal evidence and judgments in terms of external criteria. So again, could you read an article and then evaluate its accuracy, evaluate its logical argument, right? So again, you're using those lower level skills of those relationships, those definitions, and you're now incorporating all of them into making an evaluation. Next, we have the affective domain. This is looking at changes in attitudes, feelings, values, beliefs, appreciation, and interest. And so again, this is internalization because again, this is feelings from being the least committed to the most die-hard committed. And so again, these written objectives though express cognitive behaviors, or again, right, we're trying to find a way to identify in essence thoughts or how someone is thinking or feeling. So the first is receiving or attending. And so here we have awareness, willingness to receive, and controlled or selected attention. And so here now, right, the person's actually paying attention or is willing to pay attention to specific offered information. We have responding. And so here we have acquiescence in responding, willingness to respond, and satisfaction in response. So again, we now have somebody actually participating or responding to the information. Next, we have valuing with acceptance of a value, preference for a value, and commitment. And so now somebody's showing their behavior or making their choices based on this new obtained value, right, or this new value system where based on their thoughts and their feelings about things, they're now making choices that correspond with those. We have organization. So here we have conceptualization and organization of a value system. So obviously people are fairly complex and have multiple values. And so here now you're able to incorporate multiple values into this value system when making choices. We have characterization by a value or a value complex. So here we have generalized set and characterization. And so here, again, someone is completely committed to the cause. They've completely valued something. They've internalized it. And at this point, it's just automatic. So this is things like brushing your teeth, washing your hands, covering your mouth when you're sneezing, right? All the stuff that you just have done it so many times out of habit. That's just what you do when you're in polite company, and so on and so forth, right? It's just those automatic things that you've committed to and you value. Then we have the psychomotor domain. And so here again, remember this is physical abilities and skills. And again, knowing that knowledge and attitudes are interrelated. And again, similar to the previous domains, it increases in complexity. So we have perception, and this includes sensory stimulation, such as auditory, visual, tactile, taste, smell, and kinesthetic. We also have cue selection and translation. And so as the text identifies, right, this is also the recognition, right, or the perception that someone needs to learn a specific skill. We have set, which includes mental set, physical set, and emotional set. This is someone's readiness to begin learning a task, so their mental state, their physical state, and emotional state to begin learning a new task. Next, we have guided response. This is things like imitation, so you would observe the instructor with a demonstration, and then you would attempt to imitate it. It's also practice with things like trial and error. So again, trying the experiment multiple times, or trying the physical assessment in class, and again, getting feedback and improving. And so then we have mechanism, where someone first begins to gain proficiency in a task, so they actually start to get good at something. Next, we have our complex over-response, with a resolution of uncertainty and automatic performance. Again, you've done this to 100 patients. You just do it over and over again without thinking. It's never a problem. We then have adaptation. So again, if we need to then adjust our skill set. So again, I've never done it on this kind of patient before, but I know what I'm doing. I know the technique. I just need to adapt it. Or origination, which is if something's never been done before, so it's original, but again, using the underlying principles and the previous learned physical skill set, right, you're then able to create a new technique or find a technique that works. And so again, we have our three domains, our cognitive, psychomotor, and affective. So again, that's our knowledge and information, manual skills and performance, and attitudes and values. But again, they are interrelated. So again, you have to have a certain level of knowledge to perform a physical skill, but you also have to find it important to even practice the skill. If something's not important to you and it doesn't affect your attitudes or values, you won't try to learn it, so on and so forth. Now again, looking at determining the content of learning plans, again, you're going to do that pre-assessment or pre-test. Again, take a look at the learning objectives, and then again, using the taxonomies, right, using those specific verbs and then those specific levels that we've just reviewed to ensure that the objectives, right, are applied to the needs of the learner. So again, you're meeting the learner where they're at and that they achieve what you want them to at the end of the session. And then lastly, looking at learning groups. So groups can be advantageous, so again, from a cost and efficiency standpoint, but then also for more complex information, it allows for opportunities for people to share their experiences. And so again, we talked about, right, that adaptation, that origination, right? You're finding out how other people did things, right, how they mastered a task. And again, looking at, again, those pre-assessment differences in knowledge levels. So again, if you're putting people in groups, you just have to take into account that some of them may be more advanced, or do you just create different groups, and so on and so forth. And with that being said, I thank you for your time, and I look forward to your questions.